Let's start with epidurals. Epidurals and spinal blocks are medications that are used to numb the lower half of the body. The medication is inserted into the back using a small needle and catheter. Usually how this works is that the person in labor has to sit at the edge of the bed and lean over a support person while the anesthesiologist administers the epidural or spinal block into their lower back. The thing about epidurals is that some people plan to get an epidural and they get to the hospital and they're already too dilated to get one. This means that if you're already 8 or 9 centimeters dilated and the baby seems to be coming quickly, the anesthesiologist might not have time to get the epidural in before the baby comes out. Also, there are rare circumstances where an epidural will be administered and the lower half of the body does not become numb, or only half of the body becomes numb. So that means that it didn't really work. This is why even if you are planning to get an epidural, I recommend learning labor coping techniques just in case the epidural doesn't work or you're laboring too fast to get one. Now, despite common belief, you absolutely can move while you have an epidural, but your range of movement is significantly limited. Moving is absolutely vital to the labor process because it allows the pelvis to open in different areas, giving the baby room to move through it. If you do get an epidural, I encourage you not to just lie flat on your back or in a reclining position. Instead, you can try lying side to side, switching positions every 15 minutes, using a peanut ball to support your top leg. You can try asymmetrical positions. You can get into a hands and knees position with support from pillows and birth balls. Further illustration of all of these different positions can be found in the epidural module. Now, some people like to get an epidural for active labor, and then when they get close to pushing, they'll turn the epidural off or turn it down so that the person birthing can feel what they're experiencing. This might help them to push in a slow and controlled way, and also gives them the opportunity to experience the sensations of pushing. Let's talk about the risks and benefits. The benefit of an epidural is that it allows someone who's had a long labor to rest. This is absolutely necessary if someone is too exhausted to push and may prevent them from even needing a cesarean. Both an epidural and a spinal block are effective at reducing the sensations of contractions. Epidurals increase the risk of forceps and vacuum use by 42%. Low blood pressure increases by 18 times. The risk of cesarean for fetal distress increases by 43%. The risk for maternal fever increases by 3 times. The risk for utilizing Pitocin increases by 19%. Second stages of labor are increased by an average of 14 minutes, and epidurals interfere with the body's feedback system, responsible for maintaining a strong and effective labor. In a normal physiologic birth, when the person experiences a contraction, they will experience some kind of sensation. In response to the intensity of the sensation, the body releases hormones known as endorphins. It's sort of like your own pain coping chemicals are being released perfectly. If the sensation increases in intensity, your body will release more endorphins. This is why people who are having a natural labor and then later get an epidural describe the epidural as being very clear, like they can see everything, it's very clear, they remember everything. But looking back on the natural labor, they kind of felt like they were in a dream, like it was a little hazy and very euphoric. So what this means is that the same process of releasing endorphins in the body is not happening anymore because you're no longer experiencing those sensations. Another risk is that they do restrict the freedom of movement throughout labor and pushing. And even though you can continue to move with an epidural with support from other people and support from props, there is still a restriction of movement. The risk for losing bladder control increases by 17 times, often requiring catheterization. Catheters increase the risk of infection, which would require antibiotics to treat. Also, epidurals may cause respiratory depression and decreased fetal heart rates in newborns.